So before moving to the next part, I want to check your knowledge surveillance. And that is a task for exam. 3 questions you will have, main question and 1 preparation, 1 NB preparation. And you will have a tube only with the name, and that's all. You will have that BCG vaccine. And you will need to parse in details. What is it? How to obtain, how to use, what type of immunity will it provide. And of course, main task of BCG vaccine, main features of BCG vaccine we will discuss in TB class, but I will tell you now that that vaccine contains a live bacteria, Mycobacterium bovis, to prevent TB. And exam, you will need to say it yourself. What is that vaccine, what microbe contain, how to obtain it. But now my task is to check what type of immunity will provide you that vaccine. So you can pause the video and try to cross unnecessary words. I will give you the answer now, not to waste the time, but think. So as we said, vaccine preparation contains antigen, which is given after the birth. Of course, immunity will be acquired. If it is antigen, your own immunity will provide you with response. Your cells will work hardly, active immunity. Doctor will make an injection, so it is artificial. BCG vaccine, I said, contain Mycobacterium bovis, a live bacteria. Immunity will be antimicrobial, only against microorganisms. And it's not the task of today's later in that lecture I will discuss, but now I will tell you it is cell-mediated immunity. Cells are activated and the response of BCG vaccine. Second preparation, diphtheria antitoxic serum. Again, pause and click or choose correct answers. I will do it fast. As it's seen from the name, again, serum, always given by a doctor. It is acquired immunity after the birth. It is artificial. Serum contains antibodies, so antibodies will provide you with the passive immunity. Your immune system will not have a contact with antigens, no, only ready antibodies, but in that serum. Of course, antitoxic means you will have only antibodies against toxin, and you still need to give antibiotics to treat local infection. Again, it's very common error when doctors have bacterial infection with production of toxins. Doctors will give antibiotics, but they forgot to give antitoxic treatment. You need to use serum very often. And of course, serum is humoral immunity because in serum cells are absent. So hypersensitivity, the main topic. Hypersensitivity is an excessive, undesirable reaction produced by the normal immune system to the second and latest contact with antigens. And as you can see, we should have that in hypersensitivity reactions, we should have that pre-sensitized state of the host. We have another definition, sensitization. It's absent in other conditions, but in allergy, sensitization is important. Sensitization, it is a process by which an immune system will produce defensive antibodies which triggers an allergic reaction. In the first stage, you will have sensitization. Antibodies are produced, but they have no effect. Antigen will be eradicated, no reaction will occur. But in the second and latest, you will have antibodies which will fight and you will have allergy. So we have 4 main types of hypersensitivity. I will give the fast description of every next slides. We will talk about pathogenesis of every. But type 1, immediate hypersensitivity. It is IgE-mediated release of histamine and other mediators from mast cells and basophils. So again, the main example here is anaphylaxis, anaphylactic shock. That type of immune response, mainly you know very good. Type 2, cytotoxic immune or hypersensitivity. Cytotoxic, IgG or IgM antibodies bound to the cell surface antigens on the cell, and with subsequent complement fixation. Of course, complement is required. And here, as example, we have drug-induced hemolytic anemia. Type 3, serum immune complex, circulating antibody-antigen complex in blood vessels that deposit the postcapillary venules and with subsequent, again, complement fixation. Serum sickness here again. And type 4, delayed hypersensitivity. Routinely, you know, you cannot explain good, but you know that type. It is mediated by T cells without antigen-antibody complex. So first three, you have antibody as the main participant, and the fourth one, you have cells. So only 4 types. Seems like not very difficult, but again, you always mixing up, especially second and the third one. You cannot understand what's the difference. So to make it easier, content addressable memory, right? You remember that association. So I will give you that short cheating thing. Type 1. 1 is like E, I. I is very often written as E. Type 1, IgE. IE, IgE mediated. Type 2. 2 is 2. 2. To the cell. Immune complex is fixed to the cell. Type 2 is I2 toxic. Complex antigen antibody is fixed to the cell. Cyto toxic, cell toxicity. 3 is free. Complex of immunoglobulin antigen is free in serum. It's circulating free. Type 3 is free. And type 4 is related to cells, CD4 cells. CD, marker of the cell, CD4 cells, T helpers are involved in type 4. 1 IE, 2 to the cell, 3 free in plasma, 4 CD4. And they have some correlation with in time when it's appeared. -1. Type 1 and minus 0 days right now. Type 2 1 day -1. Type 2 -1 1 day. Usually 1, less than 1, or up to 1 day. Type 3 3 -1 2. 1 to 2 days. And type 4 delayed -1 3. And third day we should evaluate, but 2 to 3 days. So type 1 0 days, type 2 1 day, type 3 2 days, type 4 3 days. I think it will help. It will be kind of easier. So allergy happens with during the first contact with antigen in genetically predisposed individuals. And as you know, not everyone suffers from allergy. And some people only are affected by allergy. And then nowadays it's shown that genetic inclination is the reason of that allergy. And I'm trying to, again, show the schema. I will hide. First stage, it's the common classic order of immune response. Everything is the same. Activation of T cells by antigen-presenting cell with the contact with allergen. But here you will have Th2 cells, not common T helpers, T-specific types of allergen-primed, how to hide here, allergen cells. So you all know good. The main allergic cells are mast cells, eosinophils. So interleukin 5 and interleukin 9 will be secreted by Th2 cells. IgE, as you know, is needed. But immunoglobulins, they should be secreted by plasma cells. The same B plasma cells will be activated. But instead of IgG, IgM, they will induce IgE production, because those cells will be stimulated by interleukin 4 and 3. And that's why you will have another type of IgG. And as you know, immunoglobulins are receptors of the B cell. They're identical to B cells. And actually, those receptors will match other cells as well. They're very similar to receptors of basophil. They're very similar to receptors of mast cells. They will fixed to the surface of immune cells. And now your cells are sensitized. They're sensibilized. Before first contact, they could not be activated by antigen because they didn't have that receptor, which is specific. But now, first stage, asymptomatic, is over, and all chains of immunity are aware about structure of your allergen. And if you will have second or later encounters, you can have different types of allergy. Number 1, again, immediate hypersensitivity. It occurs within 15 even minutes after exposure. So clearly, that exposure to an antigen will lead to activation of sensitized cells. Complex will be formed on the surface of the cell, and you know that histamine is the most important involved part. So histamine, besides obvious effects, have diverse systemic activity. Mast cells will release platelet activation factor, not only histamine. That factor, as it's obvious from the name, will activate thrombocytes or platelets, leading to their aggregation and the release of, again, histamine, release of heparin, release of different vasoactive amines acting on our blood vessels. And mast cells and basophils, again, will release tryptase, which will lead to alternative activation of the complement. It directly cleaves C3 and C5 portions. If you remember that scheme again, I show you. C3 and C5 will be activated without antigen-antibody complex. It is alternative way of complement activation. And in that way, complex is not required. It will be immediate activation of immune response. Tryptase will cleave directly to compounds of complement system. So, chemotactic factor. Mainly it will induce migration of eosinophils. They will secrete major basic protein, which increases release of histamine by other cells. And you will have that circle. Activated cell will activate cell, it will activate another cell, and every cell will release more and more and more histamine. So, activated neutrophils, alveolar macrophages, they can lead to tissue damage effect. Initially, the task is to protection, but if it is under control, if it's not controlled, we have, as you can see, we have no stop chain here. That system will be self-hyperactivated. And while allergen is not removed, exposure is going on. Allergy will progress. You all should know symptoms of anaphylaxis, but again later. Now we're talking about pathogenesis. Cytotoxic hypersensitivity. In cytotoxic hypersensitivity type 2, again, to the cell, complexes are fixed to the cell. It can be induced by IgM or IgG, not that one immunoglobulin. Common immunoglobulins are involved. And they may affect a variety of organs and a variety of tissues. But the key point here, you should have complex of antigen antibody which is fixed on the surface of the cell, cytotoxic to the cell. And this complex can have several effects. It can lead to destruction of the cell. It can lead to inhibition of the cell, or it can lead to stimulation of the cell. Three options are possible with slightly different mechanism, but common chain of pathogenesis. So it can lead to cell dysfunction, cell inflammation, cell cytolysis, or cell stimulation. Let's make it clear. Cell dysfunction. Again, I try to show that scheme. Myasthenia gravis. If you know that, if you remember that, or maybe you know, autoimmune neuromuscular disorder. It is a disease that leads to weakness of skeletal muscles, and it manifests with different muscular disorders such as double vision, dropping eyelids, trouble of talking, swallowing, and other different disorders. So what is the mechanism? Again, it seems like it is common therapeutic disorder, but no, it is. In the pathogenesis, we have hypersensitivity. We have a neuron and a muscle. You remember that physiology. Neuromuscular junction here. And you know that our muscles can perform activity if they're stimulated by acetylcholine, ACR marked. And acetylcholine should be released by a neuron. Neuron releasing acetylcholine, our muscle working. So in the case of disease, in the case of type 2 allergy, antibodies against nicotinic acetylcholine receptor for muscle are formed. And here on the receptor, you will have antibodies which blocking some, it's mainly again some genetic predisposition. And acetylcholine lost, muscles cannot be activated, they became weaker. And here, as you can see, we have antigen antibody complex binded to the cell. Dysfunction. So some again photo of person with a half closed eye, fallen mouth, mainly again due to affection of facial muscles. So inflammation, again some scheme. The most known, the very known examples of inflammation is reaction of transplant rejection, transplantation. Or we have some, again, autoimmune disorders such as autoimmune glomerulonephritis, or maybe you know that Goodpasture's disease, when our immune system makes antibodies against tissues of our kidneys or lungs. Goodpasture's disease lungs are involved as well. So here again we have formation of IgG or IgM complex, which is fixed to the cell, as you can see. But we say that inflammation, again, another pathogenesis. Do you remember symptoms of inflammation? What will happen? So in the case of inflammation, of course, when immune response is activated, we have swallowing of the cell, and it will lead to appropriate corresponding symptoms. Edematous, obstructed capillaries in kidneys will lead to dysfunction. It will lead to dysfunction of organ. It can be painful. It will limit functions of an organ. And of course, as the very beginning symptom, you will have insufficiency of organ. But if it will progress, it can lead to failure and even lethal outcomes. But in the basis, again, we have cytotoxic hypersensitivity. Cytolysis, very often induced by drugs. And here, as you can see, we have another term, hapten. Hapten is a molecule that is incapable to induce immune response itself, but which can do so when fastened to a larger antigenic molecule, which is called as a carrier. So initially, term hapten originates from the Greek verb haptein, means fasten or bind. And hapten itself is no antigenic, but when it's bound to a protein, for example, some antigen of the cell or serum, it will become as a potent good antigen. So we have RBCs with normal proteins. They are tolerated by our immunity because our immunity knows that it is our own. And you have no problems. And you have a drug molecule, here it is shown, which is named as a hapten. So drug itself is too light to be recognized as an antigen, and it have no effect on our immunity. But when it fixed to the protein of our cells, it will induce immune response. Molecular weight has increased, and structure is new for our immunity. It was receptor, it was normal, but now it is a new molecule, and it is fixed to the surface of RBCs. So our immune reaction will activate immune response, L-induced cytolysis, complete destruction of the cell, because natural killers mainly, they will recognize that cell is something foreign. Of course, again, you need complement. You will have antigen-antibody complement system. And if you remember, complement have, again, opportunity to induce opsonization and cytolysis, destruction because of formation of perforin systems. So that reaction can occur in minutes to hours, but usually, again, within a day. Graves' disease, example of stimulation. I think it is the only disease which we can give an example of stimulation. But again, in the pathogenesis, it is immune-related, overproduction of thyroid hormones. If you remember the scheme of normal cell regulation, normal regulation of thyroid gland, it is controlled by our pituitary gland. And concentration of hormone is pretty stable, because decreased level of thyroid hormones will induce secretion of TSH by our gland. It will stimulate thyroid gland to release more hormones. Normal amount of hormones will suppress thyroid gland. It will decrease amount of hormones. So, and hormones of thyroid gland are responsible for metabolic activity of our body. The system is self-regulated. So we have Graves' disease, I said. It is autoimmune disorder. Overproduction is induced by, again, antigen-antibody complex, which is formed on the surface of the cell. We have production of antibodies, which are called as thyroid-stimulating immunoglobulins, or TSI. And they have very similar effect to TSH, thyroid-stimulating hormone. They will bind to the same receptor, and they will have the same effect. They will stimulate the gland. But antibodies are produced always in large amount, and they will always stimulate the gland pituitary gland cannot suppress stimulation because antibodies are always fixed. And of course, as the result of that disease, you will have in those people enlarged thyroid gland in the neck, and one of the pronounced symptoms is eyes bulging, very large eyes. So it is example of stimulation. Type 3, where an immune complex is free in the serum. You remember 3 free. Complex is free in serum. So reaction can be generalized, such as serum sickness, or it may involve only individual organs, for example, skin, if you know the systemic lupus erythematosus disease. Or we can have some rheumatoid arthritis when joints are affected. That reaction usually occurs in 3 to 10 hours after exposure, but again, can be delayed up to a day or 2 days. And it is mediated by soluble complexes of antibody antigen, which are circulating free in serum, mainly IgG are here. So antigen can be exogenous, deriving from some bacteria, and in that case we can have autoimmune disorders induced by bacteria. We will talk again. Or it can be endogenous, when tissue autoimmunity occurs. So here we have, as you can see, platelets as the main type. Platelets will aggregate and fix complex to endothelium of blood capillaries, of blood vessels. It will lead to microthrombosis, partially or complete blockage of microvessels initially. They are very small, it's easy to block them. And again, you need complement because IgG is antigen antibody complex is activated. So as the result, you will have attraction of neutrophils, you will have again worsening of tissue damage, which will lead initially to vasculitis, but again with the same symptoms of inflammation. And here those symptoms are limited again to organs. So later, if exposure to antigen is stopped, macrophages can be involved in healing process, but initially you have local symptoms: inflamed, swallowing, painful joints, difficulty in motility. So in general reactions, we have some serum sickness, when intravenous infusion of injectable drugs, such as certain antibiotics, can do that, or immune serum again can lead to that. It will induce type 3 hypersensitivity, and subject will have systemic immune reaction. So again, as far as complex of antibody antigen is in free state in serum, type 3 hypersensitivity, but it is as well immune complex hypersensitivity. So common symptoms of serum sickness are fever, rashes, polyarthritis, polyarthralgia, and all symptoms of inflammation, but generalized. The last type of hypersensitivity is delayed, type 4. And type 4 major mechanism, type 4 hypersensitivity is the major mechanism to withstand intracellular pathogens, or mycobacterium especially. Fungi, sometimes parasites can induce, but in our practice we will talk about tuberculosis and leprosy disease when mycobacterium is involved. That type of reaction can be observed in several transplant reactions, and it can be involved in tumor immunity again. But what is the main problem of that immunity? Again, I try to show the scheme. I will give you an example of tuberculin skin test. I said recently that we will discuss the delayed hypersensitivity and participation in allergic skin test. And delayed hypersensitivity, type 4, CD4 cells are involved. So CD4 type 4, again, please remember. It is possible to have CD8 cells as well, but it is double 4, type 4 CD4 cells. So CD8 cells can kill pathogens immediately. We will talk about CD4 cell mediated. 72 hours are routinely required after exposure to an antigen to have that localized inflammatory reaction, which is activated by T helper cells initially. T helpers will release cytokines, chemokines, attract macrophages. And cytotoxic cells again can be attracted here as well. Type 4 hypersensitivity is an attempt to kill, to destroy allergen very fast by cells. But cells are not really fast. So if CD8 cells are involved, they can do that. T cytotoxic lymphocytes can kill completely antigen very fast. But for us, type 4 allergy is important. We will use that type of allergy in diagnosis. Allergen, in that case, Mycobacterium, tuberculosis or bovis or any other, it cannot be killed by our immunity. And our immunity will try to isolate, to fix pathogen in tissues not allowed to spread. And the most important thing here is formation of granuloma. It will start with that part, central part of granuloma. Accumulation of different cells, pathogenic cells in our cells. It is a focal collection of inflammatory cells at the site of tissue infection. Routinely, we have 3 zones. That one is a central zone. Pathogen itself, Mycobacterium, and macrophages. Of course, macrophages will try to digest, to perform phagocytosis to digest Mycobacterium, but they will have troubles with that. They cannot destroy it by phagocytosis because of specific structure of the cell. So Mycobacterium will be surrounded by macrophages, and they will try to release some factors outside to kill bacterium here. And release of those factors will lead to necrosis, mainly caseous necrosis, caseosis, locally in tissues. It is a central zone. So, of course, it's not enough. And our immunity will understand that macrophages cannot do it themselves. They need help. And epithelioid cells will be there. Central zone will be surrounded by a mid-zone, middle zone. Activated tissue macrophages, or we call it epithelioid cells. They will make a middle zone, and they will again attract additional cells because even 2 zones are not enough. And you will have Langerhans cells here, giant cells, lymphocytes, fibroblasts. They will make peripheral zone. And of course, fibroblast is one of the main. They will try to make a rigid coverage, a shell. And if you cannot kill, at least try to fix here, not to allow to spread. And you can have as well T cells, B cells here. Of course, any part of immune cells will be here. But that type of lesion is mainly formed in lungs. And in lungs, we can have necrotic granulomas after inflammation of fungi or bacteria. But TB is included in your program. We can have blastomycosis or histoplasmosis is the type of fungal disorders. The same granuloma will be formed. So if granuloma is formed without necrosis, that state is known as sarcoidosis. And similar lesions can be formed in lungs, but as well in skin. 2 types of granuloma with necrosis. It's granuloma in infectious diseases, without necrosis, sarcoidosis. So that is a microscopic example of granuloma. You can again enlarge, take a look. The same zones, they say different type of cells are differentiated and visible here. So again, your favorite question, why should you know all that if you're going to be medical doctors? So again, our triad of a good doctor. Allergy can, if you know allergy first, of course you can prevent known complications of your treatment. But as well as we said, allergy is used in diagnosis of infectious diseases. So anaphylactic shock, I tell again that I will show you some. We said we had heterologous preparations, and they can induce type 1 hypersensitivity, type 3 as well. But type 1 is more important here because it is acute. You can have such a severe complication as is shown here. It is known as anaphylactic shock. It is systemic life-threatening infection complication of your potential treatment, which will occur in minutes after injection. And because of respiratory problems and brain dysfunction, because of severe hypoxia and generalized edema, that state can be even fatal. People can die because of that if you will not prevent it, if you will not predict, or you will not give correct treatment. So how to prevent that state? We have common rule of stepped administration of heterologous preparation, any. It is known as Bez-Redko technique. I showed here. So incorrect sequence, sorry for that. So we need to make 3 steps. First, intradermal injection of 100-fold diluted serum. It always comes in the set with the test tube. 0.1 milliliter you need to inject in the forearm, and you can use saline solution in another forearm to control just reaction on injection. And you need to observe in 30 minutes. If you have size of lesion in the place of injection less than 1 centimeter, no hyperemia, no evidence of allergy, make step 2. It is subcutaneous injection under the skin of the whole complete common serum, about 0.1 milliliter in a shoulder. And again, 30 minutes you need to supervise your patient. You need to see that no systemic reactions appeared. If nothing is good, if your subject feeling good, no fever, no headache, no severe some common tiredness or other, start with the step 3. Intramuscular intravenous injection of normal solution of serum, but again, watch your subject for the whole period of injection and 1 hour after the completing the injection, because type 3 hypersensitivity can be in few hours, even within a day. So for your self-protection, in obligate manner, always record those tried I showed again here. Name of preparation, lot number, expiration date, who is the manufacturer, reckon the time, dose, and where you administered, and complete record of the whole procedure, that you did it, that you checked your subject was fine, no allergic reactions was observed during your injection. Again, in the case of any accident in the future, it is the most perfect protection for you, documented procedure, that you done correctly, that you checked before injections. So number 1, again, we will explain, and I will need to explain how to use allergy in diagnosis of infectious diseases. Allergic skin test is the method of medical diagnosis of allergy, how to apply immunology in common medicine. So allergic skin test, it is a allergy that attempts to provoke a small controlled allergic response. It should be controlled, it should be small. So we have set of modifications, several. First one is application test. It's the most simple. Just take allergen, should be rubbed onto the forearm without any skin damage. Just apply it and take a look. That type of test is preferred when subjects have known or you suggest that it can have severe hypersensitivity. Not to provoke systemic reaction, you should have only local without any damage of the skin. So of course, if you will inoculate, you can have uncontrolled reaction, so only local application. It's the most simple, the most easy test, and as the result, you can have any symptom of inflammation. Allergy is inflammation, just remember. Redness, edema, swallowing, itching. So second test is a patch test. Patch contains suspected allergens, are applied on the back and left on 72 hours. You should check every 24 hours, but the final evaluation is in 3 days. So that test is preferred in severe hypersensitivity of delayed types. That one immediate, that one delayed in 3 days. So you can sign again what allergen is applied. Multiple allergens can be applied here. First modification, prick test. Prick test is when a drop of aqueous solution of allergen is placed on the forearm and superficial injection is done with a lancet or needle through the drop. You have a drop, and through the drop you make an allergen. Of course, allergen will diffuse in the skin. It is deeper reaction. As the result, you can have more severe response. So as an example, that test is used for TB, for tuberculosis. Intradermal test. Fourth modification, it is similar to prick test, but allergen solution is injected into the skin. Intradermal injection, not pricking. So that test is performed for weaker allergic reactions when prick test did not show good and certain results. So usually it is additional method. So the fifth and the last modification is scarification test. That device or lancet or scarificator is used. It is deep dermic scratch performed with the help of lancet, for example. Again, it is analog of a prick test. You should have a drop of allergen solution on the forearm, but to scratch in the skin through that drop. It's more deep, more specific. So any idea of listed test is the same. You always should have control allergic reaction to evaluate the result. You know what allergen you applied. You can sign, you can label. And by seeing allergic reaction, redness, edema, swallowing, pain, any symptom of inflammation is indicated that subject is hypersensitive. So the test is usually used in diagnosis of disease. Your subject is ill means contact already occurred. Your subject is sensibilized. If you apply the test, it's appeared red, your subject is hypersensitive, means disease is in progress or it was a recent contact. So again, common principle, common idea of the test, you should mark zones. You should of course know in which zone, which antigen is placed, or in which dilutions is it placed. And in appropriate time period, you should evaluate reactions. If nothing is appeared or zone is less than 5 millimeters, usually it is non-specific reaction, shows negative result. If redness appearing, edema, swallowing, pain, or itching, test is positive, you know your subject is predisposed to certain allergens. So that's the only task for you for today, to understand, to be able to differentiate between three types of IB preparations: vaccine, diagnosticum, and immune globulins, immune serum, and how to apply it correctly. So please, again, try to remember that simple, easy topic, and you will be able to answer good. For today, that's all. See you next lectures. Bye-bye.